Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and Little Rock Public Radio.
And welcome to Arkansas Week. I'm Dawn Scott. Thanks so much for being here. After extensive research, a group formed to look at problems with foster care in Arkansas has released recommendations on how to improve the system. That is coming up later in our program. But first, cancer patients in the state now have access to an advanced form of treatment. The Proton Center of Arkansas, located at UAMS's Winthrop P. Rockefeller Cancer Institute, uses the most advanced form of radiation to destroy tumors in areas of the body that are difficult to reach with standard radiation. A ribbon-cutting ceremony for the $65 million center was held in July, and it opened for patients the last week of September. It is a collaboration between UAMS, Baptist Health, Arkansas Children's Hospital, and Proton International. And joining me to discuss the significance of this new center are two physicians from UAMS. First, Dr. Zhong Su is the director of physics there, and Dr. Sanjay Maraboyina, who is the medical director of radiation oncology, also an associate professor. We sure appreciate both of you coming in to discuss this. This is revolutionary. How big of a step forward is this here in Arkansas?
Thanks for having us, Dawn. This is a major impact for the thousands of Arkansans that are affected with cancer. The opening of the Proton Center is the 43rd in the nation. So Arkansans with cancer will have access to this very important treatment.
Well, Dr. Su, talk more about this, this advancement here in Arkansas.
Yes, the state-of-art technology combined with physics and help in Arkansas cancer patients. So this is quite a big deal.
I'm curious, what is proton therapy? What exactly can it do? I've read a bit about it, but for viewers watching who really have never heard of this, explain what it does.
It's a very good question, Dawn. So in a nutshell, when a patient is affected with cancer, they are treated with either surgery, chemotherapy, and radiation. The two types of radiation are X-ray based or proton. So there's a significant physical difference in the characteristics, but the major take-home point, or why patients benefit from proton therapy, is how the dose is delivered, how it enters the body, how it exits the body, and the amount of scatter radiation, what we call like collateral damage, that goes to the rest of the body. So targeting the tumor accurately and reducing the side effects of radiation.
How did we come to get this therapy? What did researchers find? How did it come to be here in Arkansas?
Right. So proton therapy in U.S. For I think almost 20 years, a lot of clinical data demonstrated for the patient less toxicity, both acute and late effect. It's all benefit to the patients.
And it targets tumors in areas of the body that are difficult to reach. Is that true?
Yes. And also, as Dr. Sanjay Maraboyina said, basically the radiation, the less damage of the normal tissues due to the physics properties of proton.
And you opened in last week of September. Have you been seeing patients?
Yes, we've been busy, and we treated our first proton patient last week.
And what is the time frame for this? I know it probably differs based on the type of cancer and where it is in the body.
That's true, yeah. So for some simple cases, it is taking probably 20-30 minutes to finish the one treatment fractions. For some of the complex cases, need treating a longer target, they have to have longer time. It can be up to an hour for some of the pediatric cranial spinal irradiation patient.
And this is several times that a patient would come, correct, depending upon their diagnosis?
Yeah, so the initial visit will start with a consultation, and the doctor will determine what the treatment plan is for the patient, if proton therapy is appropriate in their plan of care. And then from consultation, there will be something called a simulation. It's a dry run of how the patient will be treated. And then usually about 2 weeks after that, the patient will begin treatment. And a treatment course typically is every day, Monday through Friday. Could be up to like 8 weeks.
Wow.
So it's a lot for the patient.
That's very intense. And would there be a patient population or group of people where this would not be appropriate, where they might need to do the more traditional?
Yeah. So
treatments?
when you look at cancer care in general, more than half to 75% of patients receive radiation therapy. So that's either in the curative or palliative intent. So the patient will be seen in consultation and determine if proton therapy is appropriate for them.
And so specifically, other cancer treatments that we've kind of discussed, the radiation, chemotherapy, how specifically does this differ? Maybe from a physics standpoint and then also from a treatment perspective.
Right. So from physics point of view, this one, you have the proton will stop with your decide what energy you use. So with the target and the surrounding normal tissues, we as physicists and the dosimetrists, we can look into the patient geometry and come up with a treatment plan that the proton will stop right after treating the tumor. So the normal tissue surrounding, especially beyond at the distal end of the tumor, will not be irradiated.
Targeted in a completely different way.
Yes.
And then what that looks like for the patient is...
So we treat adults, and this is very important treatment for our pediatric population. So children, infants to toddlers are candidates for proton therapy. And the physical characteristics, as Dr. Su was describing, how does it translate clinically? So for example, if a patient is receiving radiation and the beam enters from the back, and then normally with X-ray, it exits through the front. So what the properties of proton therapy, why it's unique, why it's important, is that stopping distance. So if you're treating a tumor of the spinal cord, it'll stop right in front of the spinal cord, and so you don't have that exodus. So think about what's right in front of your body, your lungs, your heart, your stomach. So those organs are spared the side effects of radiation, which could be detrimental in the children population.
And this is successful. I mean, obviously, or we wouldn't have brought it here, but what can you cite examples or cases where it's really worked for someone who might have had trouble with other treatments for cancer?
There's ongoing studies comparing X-ray and proton therapy, and as Dr. Su said, this technology has been around for decades, and there are numerous what we call single institution or retrospective studies that have shown a benefit to proton therapy, and we're awaiting results of much larger studies to show that, hey, maybe there is a survival benefit. Other patients could be living longer. Does proton therapy have better disease control? Right now, it's limited based on the disease side. The main indication for proton therapy is that decrease in scattered radiation, that low dose.
So just more protecting the patient better.
Right. So right now, I think we're using the similar dose levels to the as compared to the photon patient. So there are less toxicities.
Yes.
So there are some other centers is doing the dose escalation, basically increase the dose more than the photon side because of the proton physics properties.
I see.
So the toxicity might be slightly higher compared to current proton, but still lesser than the photon toxicity. So in this case, can be a better disease control possibly. Yeah.
What types of cancer is this best for, in your opinion?
We treat all types of what we call solid tumors. So anything from brain tumors, head and neck, lung tumors, abdominal tumors, so all types. And like I said, adult and pediatric population.
But back to those tougher tumors to get to or to access or to treat that might bring toxicity with other forms of treatment. This is so much better, it sounds like.
This is a big improvement.
Yeah, this is far superior. Yeah. Many times the patient has said, I've already had radiation, and they'll question, am I a candidate for radiation again? Traditionally, we would usually say the answer is no, because you've had that full dose of radiation. But now with proton therapy, we can entertain the thought that, hey, maybe we can deliver curative radiation therapy for a patient again.
And risks of this, are there any? The risks of, you're both looking at either one, yeah.
So there's nothing magic about proton therapy. It is still a form of radiation, has different physical characteristics. So there is still the side effects from treatment, but it's much less than with traditional X-ray treatment.
So the proton certainly, based on our current studies, give a lesser dose to the patient, normal tissues, so therefore lesser potential secondary cancer down the road. And that's why the pediatric patient population is the most beneficial of this technology.
Why now? If it's been around for decades, why now are we just opening this center? Was it financial, or what were the reasons?
So in the early 2000s, there were about 5 centers in the United States that had this technology. So these are massive undertakings, huge construction projects. And so patients had to fly around to these centers to receive this very important treatment. But the technology has evolved where proton therapy is accessible in a single center, and it's become more cost effective. So like I said, we are the 43rd proton center in the United States, and they're projecting in the next 5 years that the number of proton centers in the United States will almost double. So what this means for the cancer patient is greater accessibility, and especially for patients in Arkansas who traditionally had to travel out of state, whether to MD Anderson in Houston or Memphis in Tennessee at St. Jude's. But patients can receive this very important treatment close to home.
Sure, and we'll have people coming probably from other areas, rural areas in the South to our center.
Right. Yeah, as Dr. Maraboyina said earlier, the proton therapy is this multi-room system, so it's quite expensive. I came from University of Florida Proton Therapy Institute. They have this 3-room building. Everything costs is more than $100 million, which is a very much a financial threshold. Since the last decade, there is a single-room system options gradually developed. What our system is a single-room system, which the financial threshold is much lower, and that's why we can get this proton therapy into Arkansas.
Nice. And insurance covers this, yes?
For majority of cases, insurance does cover this. Some insurance companies say that this is experimental, but as advocates for cancer patients, we do what we need to do to make sure that patients have access to this treatment.
Final thoughts. We just have about a minute left.
I'm excited about this technology that is available for our cancer patients. I'm kind of in the middle of my career, and it's a very exciting time to be a part of this partnership in taking care of cancer patients in Arkansas.
I'm so glad that I can be part of this team from the very beginning, building up this center, bringing this new technology and make it happen. And we start treating patients since last week.
All right, proton therapy here in Arkansas. Dr. Zhong Su, thank you so much, and Dr. Sanjay Maraboyina. We do appreciate both of you coming in to our program today and speaking about this. Thank you so much.
Thank you, Dawn.
Thank you so much.
Thank you. And more on the new recommendations to improve state foster care coming up after a short break. A strategic plan to improve Arkansas's foster care system has been released. It includes 11 recommendations from a working group created by Governor Sarah Huckabee Sanders to find additional ways to protect vulnerable children, to support foster families in the state, and work with stakeholders to improve the foster care system. Here to discuss the plan are 2 officials from the State Department of Human Services. First, Mischa Martin is the Deputy Secretary for Youth and Families. Also, Tiffany Wright is the Director of the Division of Children and Family Services. And a partner in the project, Arkansas Baptist Children and Family Ministries Executive Director, Derek Brown. I want to thank all 3 of you for being here. This is a complex topic. It'll take some time to get straight to the heart of it all. But Secretary Martin, tell me about the background of the members of this working group, who they represent, and what they're tasked with.
Well, as we were tasked to putting together a work group to address the problems in foster care and more broadly child welfare, we made sure that there was stakeholders from all different sectors of the work. Everything from our nonprofit partners like Project Zero, the Call, placement partners, mental health providers, medical service providers, education, other state agencies. There were over 130 members of the working group, and they really did make up a wide range of service providers and advocates in this space.
You know, I'm curious, 11 recommendations were presented, and what do you view as new? When you look at a lot of these, it's like, you know, aren't we already doing this? But in your opinion, is that true?
Well, there are some new things in the recommendations, and there's also things in the recommendations that maybe we're doing on a small scale, maybe in parts of the state, but we need to learn from what's working well, and we need to expand it to other parts of the state. And the working groups were divided up into 3 work groups, and all 3 areas of work were so important and needed improvement.
What are those 3 areas? I've read through some of this, but I know some of it involves mental health. What else?
Right, so there was, the first working group was prevention and mental health services. The second working group was on foster care and permanency and safety. And then the third work group was on foster home recruitment and retention. And that really focused on recruiting foster homes, but as well as figuring out how to support and maintain those foster homes in the system.
I want to move to you, Tiffany. How, in your opinion, will these recommendations that will be implemented help specifically children in the system, but also the families who host foster children?
Yeah, so the recommendations really dig in and continue to expand upon things, those small things that were happening across the state. And I think that when we look at each of these very specific recommendations, they really push forward that continued care that kids in foster care get, but also push forward the work that's happening in those local communities and really give, in my opinion, those local communities more tools to help families, not just in foster care, but before foster care. And then while we have children that are in foster homes, to support those foster parents and make sure we have key services available.
In terms of some of these recommendations, it seemed to me in reading through what I have read through that you're treating also the child more holistically in terms of all their needs, not just, oh, let's get them in a family so that they have protection in the immediate, you know, future, but hey, they've got education, there's mental health issues. Is that true?
Yeah, I would say it's definitely taking that holistic approach and really wrapping around not only the child, but the family too, right? Because if we're supporting the foster family, then they're able to meet the needs of the child we're placing and make sure that those services are targeted for that child or that family.
And to you, Derek, give some background on your group. I know you were the Arkansas Baptist Children's Home, but you've changed your mission as well.
Yeah, so our goal today is to build, strengthen, and restore Arkansas families for God's glory. And really that ties directly into what we're doing through this executive order, just working with families before, during, and after foster care.
You know, it's interesting. So you're a private organization. So part of this is, you know, there are families who want to foster children that are approved by the state, but you're a private group approving these families. Explain the difference there.
So we have a contract with the state. We work directly with them to provide case management and support for foster families. So everything from beginning to end, we recruit, train, do the home studies, do the placement, and then do the case management support for these children and their families to get them to permanency. And so we work with them through that active foster care stage that they go through.
This is recommendation 9 specifically to continue to expand the use of private license agency foster homes. Why is that important to have private groups on board?
I think it comes down to one thing. Really, the goal in that group is to talk about recruitment and retention, and that's what we do specifically on the retention piece. As a private placement agency, our goal is to make sure that that foster family has everything they need to be successful for the child. And with that one goal in mind, I think we're able to have a success that a caseworker who works with the state who has several goals that they have to accomplish maybe can't meet quite as well. And so we're able to assist them in doing that one part of the case plan well.
And Mischa, that alleviates some of your burden, whereas, you know, you're tasked with not only helping the child finding the foster family, but also dealing with the biological families as well.
That's right. And also what it's allowed the state to do is to be able to focus more support on the relatives, because over the last 7 to 8 years, we've been very focused on making sure that if there was an appropriate relative to care for the kid in foster care, that children were placed with those relatives, but that also means they needed support from the state. Excuse me. And so with partnering with our private licensed placement agencies, they can focus on providing that good case management and support to our foster homes. And the state can do more focus on providing relatives to support for the kids that are in their homes too. So that we're making sure everyone is hopefully getting the support that they need.
And it's not, just to be clear, it's not just his group that's the private group, where there are many all across the state.
There are several, and as you can tell, Derek's executive director of a faith-based organization, but we also have other faith-based and non-faith-based organizations that are opening and licensing and supporting foster homes.
Did the group, let me ask this, were all the recommendations that the group made adopted by the state?
That's correct. It really was a partnership between the state and our stakeholders. So Department of Human Services took up the lead in organizing the work groups, and then we worked with each of the work group leads. Dr. Brown was one of those leads on the mental health and prevention, but we worked with those leads to come up with recommendations that we would implement and that our partners would support.
How will they be implemented? I mean, that's probably not a real simple question. It's going to take a lot of work.
It is not a simple question. There's 11 recommendations, but I will note that it's bigger than just Children and Family Services. So in working with Director Wright to identify which ones will be owned by Division of Children and Family Services, but to some of the recommendations around prevention and mental health services, we'll be working with our partners and our other divisions within DHS, like Medicaid, or TANF, to make sure that we're offering the complete array of services that's needed to truly serve families. And as many don't realize, we serve more children in home than we do actually in foster care.
How do you, when you're making this happen, when you're implementing such a broad range of recommendations, and maybe Tiffany, you have the answer to this, that you keep it child focused? Because a lot of this is groups here, mental health here, all these big terms that are so important, but how do you just keep the child at the center of it all?
I think we have to remember our why we're all here, why we all came to the table and made these recommendations, remembering that children and families are at the heart of every decision that we'll be making. And it's going to be hard work, but it'll be worth it in the end. But I think when we think about the bigger impact that it'll make, even though we're focusing on the child, we really are going to be getting families and future generations with this work now.
And you, Derek, are I'm assuming, in front of these families on a daily basis, and the children as well, helping.
Absolutely. And if you look at the executive order, the way that we developed this work group, think about it being child-centered. If you think about the three most important elements of trauma-informed care, the first is safety, which was one of the groups of the work group. The second is about resiliency, which was the second group. And then the third is about trusting relationships, which is the third group. And so even though you see 11 recommendations, they really are grouped very specifically according to what's most important in trauma-informed care. So.
And do you think these are necessary, Tiffany? I'll start, we discussed it. Yes, some of this is not new, but in your opinion, does this streamline it and make it easier for you to do your job?
Yeah, I think the thing that is one of my favorite things about this is this does not make DCFS alone in doing this work. It really is bringing in partners and stakeholders from all over the state and experts to walk alongside us. And I think that makes it easier for DCFS, but it also makes it easier for the work that's happening in the communities. So,
Tiffany, I have to piggyback off what Tiffany's saying, because we haven't mentioned it, but it's so important and part of our initiative. As we talk about all these partners coming together, we actually have a collaborative partner, Every Child Arkansas, and that organization is helping bring the partners and us together, so that it's more than just this executive order and the recommendations. We've got a commitment from the state and from our partners that we're working together as Every Child Arkansas to improve outcomes for children and families.
How many children are in foster care right now in Arkansas?
There's about 3,900 children in foster care.
And will there be a way to assess, are these recommendations working down the road?
Yeah, so everything we do at the department, we try and be very data driven. So while for foster home recruitment and retention, have already worked with our partners and put together specific data charts so that we're tracking our progress on foster home recruitment and retention. Now, on some of the other recommendations, we'll use different data points to figure out, are we seeing improvements or not? One of the community approaches that's being worked on in some areas is 100 Families, a partnership with Restore Hope, and they're tracking their data and outcomes to show improvements in their local communities.
Final thoughts. We just have about a minute left. Derek, we'll start with you. Just any final thoughts on the recommendations?
Yeah, of course. You know, the beautiful thing here that we have in Arkansas is an incredible system of collaboration. All of this is about just maximizing the resources. We believe as a group that we have the resources here that are needed to pull this off. And it's about maximizing those resources and then increasing accessibility to those resources. And so as we move toward implementation, that's really what this is going to be about. How can we make the resources more accessible to families?
Mm-hmm. And you as well.
I think for me as the Child Welfare Director, I'm not in this alone, and the recommendations really solidify the work through the collaboration and how we can support children and families.
Mm-hmm. We appreciate you all being here. Mischa Martin, the Deputy Secretary for Youth and Families, along with Tiffany Wright, the Director of Division of Family Services, and of course, Derek Brown with the Arkansas Baptist Children and Family Ministries. All of you have given us such great information. Thanks so much. And that does it for us for this week's Arkansas Week. Thanks for being here. I'm Dawn Scott. We'll see you next time.
Support for Arkansas Week provided by the Arkansas Democrat Gazette, the Arkansas Times, and Little Rock Public Radio.